In 1940, thought for 5 sin 1945, Grand Rapids, Michigan became the first city in the world to add fluoride to its public water supply. The official story called it a brilliant public health initiative, a clean victory of science over tooth decay in children. The American Dental Association endorsed it. The Public Health Service championed it. Within a decade, thousands of American cities followed. By 1960, more than 50 million Americans were drinking fluoridated water. Today, that number exceeds 200 million. But what if the real story had nothing to do with protecting your teeth? What if fluoridation was really about protecting something else entirely? The profits of America's largest industrial manufacturers? And what if the very same companies poisoning workers and entire communities with fluoride waste needed a way to transform that toxic liability into a public health miracle? This is the part they do not teach in dental school. The story of how aluminum giants, fertilizer conglomerates, and weapons manufacturers turned an environmental disaster into a billion-dollar solution. How they funded the research, shaped the studies, and sold a narrative powerful enough to convince an entire nation to drink their industrial waste. How the same government agencies supposedly tasked with protecting public health became, in practice, the marketing arm for industrial polluters. And it all began with a lawsuit dangerous enough to threaten the companies building America's war machine. A lawsuit so explosive that it demanded the full weight of American industry and government to shut it down. The answer they came up with was elegant, profitable, ruthlessly effective. And it required only one thing: convincing millions of people that poison was actually medicine. Before fluoride became a household name, it was a nightmare for American industry. During World War II, aluminum production exploded to meet military demand. The metal was essential for aircraft production, and factories ran around the clock churning out material for bombers, fighters, and transport planes. A single B-17 Flying Fortress required more than half a ton of aluminum. The industry was producing aluminum at a pace that would have seemed impossible only a few years earlier. But aluminum smelting creates massive amounts of fluoride as a byproduct. That was not a side issue. That was built into the chemistry. The process involved dissolving alumina in molten cryolite, and that process released fluoride in multiple forms. Gaseous hydrogen fluoride escaped through smokestacks. Particulate matter carrying fluoride compounds settled over everything downwind. All of it toxic, all of it entering the air and water around these plants. There was no way to produce aluminum without producing fluoride. The chemistry made that unavoidable. And then the signs started appearing, one after another. Communities near aluminum factories began reporting something terrifying. Cattle lost their teeth, then they lost weight, then they died. Fluoride was accumulating in their bones and organs. Crops failed in the fields. Apricot trees stopped bearing fruit. Corn would not grow. Workers inside the plants developed skeletal fluorosis, a crippling bone disease that caused chronic pain, stiffness, and eventually deformities severe enough to destroy normal life. The disease was already known in industrial medicine, but publicly, almost no one wanted to talk about it. In Deepwater, New Jersey, farmers watched peach orchards wither and die downwind from a DuPont chemical plant that was producing fluoride for the Manhattan Project. The peaches that did survive were spotted and impossible to sell. Chickens stopped laying eggs. Horses went lame. The farmers knew something was wrong, but DuPont denied responsibility. The company blamed poor farming methods, bad weather, anything except fluoride. Out in the Columbia River Valley of Washington state, the same pattern emerged on a much larger and more dangerous scale. Fluoride emissions from an aluminum plant processing uranium for the Manhattan Project at Hanford poisoned everything for miles. Hanford was producing plutonium for atomic bombs, and that process required enormous quantities of fluoride. Workers at the plant were breathing it. Nearby families were drinking water contaminated with it. Cattle grazed on grass coated in fluoride dust. During the war years, livestock mortality near Hanford jumped dramatically. And then the lawsuits began to pile up. Farmers sued Alcoa, the aluminum company of America, the dominant producer that controlled nearly 90% of American aluminum output. They sued DuPont, which ran both aluminum and chemical facilities. They sued Reynolds Metals, They sued dozens of smaller companies. These were not vague accusations. These were detailed and devastating cases. Farmers brought in veterinarians who testified about the specific symptoms of fluoride poisoning. They brought in agronomists who examined soil and plant tissue. The fluoride levels were undeniable. The companies were staring at liability that could run into hundreds of millions of dollars. Entire facilities might have been forced to shut down. Others might have been required to install expensive pollution controls that did not yet exist. At the height of the war effort, that was unthinkable. Aluminum was not just profitable. It was essential to national defense. Curtailing production could mean fewer aircraft, slower military supply deliveries, and a weaker war effort. The government made its position clear. Aluminum production had to continue at all costs, so the industry needed a solution. Not to the pollution itself, to the liability. That was the real emergency. They needed fluoride to look harmless. Better than harmless, they needed it to look beneficial. If fluoride could be rebranded as something useful, even healthy, then the lawsuits would collapse under their own weight. How could something added to public drinking water in the name of health be treated as a dangerous pollutant? The strategy was audacious, but it had a brutal kind of logic. And that is exactly what they set out to do. Enter Gerald Cox, a researcher at the Mellon Institute in Pittsburgh. The Mellon Institute was not some neutral academic institution pursuing truth for its own sake. It was an industrial research laboratory funded directly by Alcoa and other aluminum manufacturers. Its purpose was clear: provide scientific cover for industry interests. Companies funded research fellows. Those fellows conducted studies that aligned with corporate needs. The results were then published in scientific journals, which gave the work an appearance of academic legitimacy while serving commercial ends. And Andrew Mellon, the financier behind the institute, was not just another industrialist. He had served as Secretary of the Treasury under 3 presidents. He was one of the wealthiest men in America. His family controlled major holdings in Alcoa. So when the Mellon Institute published fluoride research, this was not detached science. It was damage control dressed up in lab coats. In 1939, Cox published a paper suggesting that adding fluoride to drinking water could reduce tooth decay. The evidence was thin. It relied on limited observations and shaky extrapolations. The methodology was deeply suspect. Earlier research had shown correlations between naturally occurring fluoride in water and fewer cavities, but those studies carried serious flaws. They did not control for diet, income, access to dental care, or the countless other variables that influence tooth decay. And the fluoride levels in those natural water sources were not the same as what Cox was proposing to add artificially. But the timing was perfect. Here was a scientist working at an institute funded by the same companies drowning in fluoride waste. And suddenly he was proposing that this waste product should be added to public water supplies for health benefits. The audacity was breathtaking. The aluminum industry had a toxic liability already costing millions in lawsuits and threatening billions more. Cox handed them a way out. And Alcoa did not simply fund the research. They amplified it. They hired public relations firms. They lobbied the American Dental Association. They pushed the message through medical journals and public health conferences. The narrative was simple, elegant, and easy to sell. Fluoride prevents cavities. Fluoridation is safe. Opposition to fluoridation is anti-science hysteria. But there was a problem. The early studies on fluoridation were deeply flawed. The most famous study, conducted in Grand Rapids and Muskegon, Michigan, was supposed to run for 15 years. Grand Rapids would fluoridate its water. Muskegon would serve as the control city. After 15 years, researchers would compare dental health in both cities and determine whether fluoridation actually worked. But the study never made it that far. After only 6 years, Muskegon also fluoridated its water, destroying the control group and crippling the study's original design. The lead researcher, H. Trendley Dean, worked for the U.S. Public Health Service, which was already promoting fluoridation before the study was even complete. Dean's own data showed only marginal benefits, and even those were questionable because the study had been cut short. But by then, it no longer mattered. By the early 1950s, Fluoridation was already being marketed as settled science. The American Dental Association endorsed it in 1950. The American Medical Association followed in 1951. City councils across America voted to fluoridate, often with almost no public debate and no serious discussion of where this fluoride was actually coming from. And that silence was not accidental, because here is what they did not tell people. The fluoride added to public water was not pharmaceutical-grade sodium fluoride. It was hydrofluorosilicic acid, a toxic waste product from the phosphate fertilizer industry. When phosphate rock is processed to make fertilizer, it releases fluoride gas. That gas used to be vented into the atmosphere, poisoning everything downwind. Then scrubbers were installed to capture it. What came out of that process was hydrofluorosilicic acid, a corrosive liquid classified as hazardous waste. Before fluoridation, fertilizer companies had to pay to dispose of it. After fluoridation, they could sell it to municipal water systems. A liability became a profit center. The same substance considered too dangerous to release into the air was now being added to drinking water and celebrated as a public health success. From a business perspective, the switch was brilliant. Fertilizer plants were concentrated in Florida and a handful of other states. Fluoride pollution from these plants was causing the same devastation already seen around aluminum smelters. Cattle were dying. Crops were failing. Lawsuits were mounting. In Polk County, Florida, the center of phosphate country, farmers sued fertilizer companies over fluoride damage in what became one of the largest environmental cases of that era. The companies needed an escape route. Fluoridation gave them one. If fluoride was beneficial, then how could it be harmful? If cities were paying to add it to water, then how could it be treated as a pollutant? The narrative was already shifting, and the fertilizer industry climbed aboard without hesitation. But aluminum and fertilizer were not the only industries with a fluoride problem. The Manhattan Project had an even bigger one, and it was buried under the highest levels of government secrecy. Producing enriched uranium for atomic bombs required vast amounts of fluoride. The process used uranium hexafluoride, a compound in which uranium atoms are bonded to 6 fluoride atoms. That compound allowed uranium to be converted into gas for the diffusion process that separated the rare uranium-235 isotope from the more common uranium-238. The scale was enormous. The gaseous diffusion plant at Oak Ridge, Tennessee, used thousands of tons of fluoride. The Hanford site in Washington state, where plutonium was processed, used even more. These facilities ran day and night, processing radioactive materials and generating fluoride waste on a scale the country had never seen before. And much of that contamination did not stay inside the fences. Workers were exposed to both fluoride and radiation. Communities downwind were hit with fluoride fallout. Workers at the plants got sick. Dental fluorosis, the discoloration and weakening of teeth caused by fluoride exposure, began appearing at alarming rates. Some workers developed more serious conditions: skeletal fluorosis, kidney problems, neurological symptoms. But these facilities were classified. The government could not admit what they were doing, and it certainly could not admit they were poisoning people while doing it. Lawsuits had to be settled quietly, often with gag orders attached. Farmers had to sign non-disclosure agreements in exchange for compensation. Evidence had to disappear. Then decades later, declassified Manhattan Project documents released through Freedom of Information Act requests revealed something stunning. Government officials had been deeply concerned about fluoride liability, and they knew the public health case for fluoridation was weak at best. Internal memos showed they viewed fluoridation not simply as a health measure, but as a legal shield. If fluoride was declared safe enough to add to drinking water at 1 part per million, then proving harm from lower environmental exposure caused by industrial pollution would become nearly impossible. One document in particular stood out. A 1944 memo from Manhattan Project lawyers to the head of medical research explicitly discussed the need to combat fluoride's reputation as a toxic substance. The lawyers were worried about litigation from workers and nearby